Imagine a quiet ache in your belly. At first it feels small, easy to ignore. You tell yourself it's just gas or something you ate. But hours pass, and the pain doesn't fade. Instead, it moves, it sharpens, it demands your attention. Today, let's talk about appendicitis, not as a textbook condition, but as a real story your body might be trying to tell you. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes, and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. What is appendicitis? Deep inside the lower right side of your abdomen sits a small finger-shaped pouch called the appendix. Most of the time, it stays silent. You don't even know it's there. Appendicitis happens when this small organ becomes inflamed, often because its inner opening gets blocked. Bacteria multiply, pressure builds, and suddenly, that quiet organ becomes a medical emergency. Appendicitis can affect anyone, but it's most common between the ages of 10 and 30. It doesn't always announce itself clearly, and that's what makes it dangerous. How the pain begins. For many people, the pain doesn't start where you expect. It often begins around the belly button, dull, vague, uncomfortable. Then, slowly, it travels to the lower right side of the abdomen. As the inflammation worsens, the pain becomes sharper and more intense. Simple actions like walking, coughing, or even laughing can suddenly feel unbearable. Along with pain, the body may respond with nausea, vomiting, loss of appetite, or a mild fever. Some people feel bloated. Others notice constipation or diarrhea. In pregnancy, the pain can appear higher in the abdomen because the growing uterus pushes the appendix upward. Another reason diagnosis can be tricky. Why it hurts more over time. Inside the abdomen is a delicate lining that reacts strongly to irritation. As the appendix swells, it irritates this lining, making movement painful. Doctors often check this by gently pressing on the abdomen and releasing. If the pain worsens when pressure is released, it's a sign that inflammation has reached deeper layers. The body may also tense the abdominal muscles automatically, a protective reflex called guarding. It's your body trying to shield itself from harm. How appendicitis is diagnosed. Diagnosis starts with listening. Your symptoms, your story, how the pain began, and how it changed. A careful physical examination follows. In some cases, a rectal or pelvic examination may be needed to rule out other causes of pain. Blood tests help check for infection by measuring white blood cell levels. Urine tests make sure the pain isn't coming from the kidneys or urinary tract. Imaging tests like ultrasound, CT scan, or MRI help confirm the diagnosis and assess severity. Appendicitis happens when this small organ becomes inflamed, often because its inner opening gets blocked. Bacteria multiply, pressure builds, and suddenly, that quiet organ becomes a medical emergency. Each step matters, because catching appendicitis early can prevent serious complications. Treatment options. In most cases, appendicitis is treated by removing the appendix, a procedure called an appendectomy. Before surgery, antibiotics are often given to control infection. The surgery can be done in two main ways. One uses a few small cuts and a camera. This is minimally invasive and usually allows faster recovery. The other uses a single larger incision and may be necessary if the appendix has already burst or infection has spread. Most people stay in the hospital for 1 to 2 days after surgery. In some situations, if the appendix has burst and formed an abscess, a pocket of pus, doctors may first drain the infection and treat it with antibiotics. Surgery can follow later, once the body is stronger. Occasionally, mild cases can be treated with antibiotics alone. But when the appendix is not removed, there is always a risk of appendicitis returning. Why appendicitis can be dangerous. If untreated, the appendix can burst. This releases bacteria into the abdomen, causing a widespread infection called peritonitis, a life-threatening emergency. An abscess can also form, trapping infection inside the abdomen and requiring drainage and prolonged treatment. These complications are the reason sudden, severe abdominal pain should never be ignored. Recovery and healing. Healing takes time and patience. After surgery, activity is limited for a few days or weeks, depending on the type of operation. Gentle walking helps circulation and recovery, but heavy activity must wait. Supporting the abdomen with a pillow when coughing or laughing can reduce pain. Rest is essential. Fatigue is common, and it's the body's way of healing. Pain medicines should help, but if they don't, it's important to speak up. Pain slows recovery. Children often return to school quickly, but need more time before sports or physical strain. Listening to your body. Appendicitis is not subtle forever. It starts quietly, but it doesn't stay quiet. Your body knows when something is wrong. Sharp, worsening abdominal pain is a message that deserves immediate attention. Early care saves lives, and timely treatment leads to full recovery for most people. Key takeaway. Appendicitis is common, treatable, and serious if ignored. Pain that moves, worsens, and doesn't go away is never something to wait out. When in doubt, seek medical care. Trust your instincts. Your body is always communicating. You just have to listen. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes, and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.